Awesome. Thank you so much, Shelby. And thank you for everyone attending here tonight. I hope that everyone survived Snowmageddon okay. I'm really grateful that y'all are here with us tonight. So anybody who knows me knows that this is a topic that's really near and dear to my heart. And I'm really excited to be able to share with you some information on freezing your eggs or some fertility options for us. So let's go ahead and get started. And again, I'm Reem Sabouni. All right. So what is egg freezing? Let's start with the basic question. Okay. So essentially what egg freezing is it's about preserving your reproductive potential in women of reproductive age. So this goes by so many different names. If you want the real technical term, it's the planned oocyte cryopreservation. That's the currently in vogue medical terminology for it. But it also has previously gone by social or elective egg freezing. Some people even call it egg banking or even egg insurance. So let's go through a little bit of the history because this is actually a relatively new field. So when we think about egg freezing, it's essentially the process of IVF without the actual fertilization of the egg. So how we get the eggs is exactly the same as IVF. So the first birth that came from IVF was in 1978 with the birth of Louise Brown in Europe. It wasn't until 1981 when Elizabeth Carr was the first IVF baby in America done at the legendary Jones Institute, which is where I did my fellowship. In 1986, that was when we had the first reported birth utilizing a frozen eggs, okay? And it wasn't until relatively recently, in 2013, that the American Society of Reproductive Medicine, or ASRM, repealed the experimental label on egg freezing. And it basically said that the success of oocyte cryopreservation has improved dramatically over the past decade, and preliminary data for safety is reassuring. So therefore, this technique should no longer be considered experimental. And so, as you know, across the country, many different fertility clinics have been doing this procedure more and more commonly over the past many years. So why is fertility preservation important? Well, we know that women are deferring childbearing for multitudes of reasons, which we'll go into a little bit. But essentially, we as women, we're born with the set number of eggs we'll ever have in our life. So as seen in the graph, when we're born with about 1 to 2 million eggs. And over our reproductive life, we're constantly losing eggs, and we have no capability of replenishing our own natural eggs that we have. Until about the age of 31, you start to see a pretty interesting decrease in our fertility. And then that decrease kind of sharply turns down dramatically around the age of 37. And then really, like when we hit our early 40s is when we kind of start to see this like end of fertility. It's not the fact that we have no eggs at that time, but it comes down to a quantity and a quality issue when we are in our 40s dealing with this. And so one of the things that's kind of misleading is that commonly in social media and, you know, seeing the actresses and the stars, we see plenty of these role models that we have that are getting pregnant at relatively older ages. And so the question becomes that, are we overestimating the ability of reproductive medicine in order to restore our body's ability to produce these eggs? Or are these actresses really utilizing donor eggs in their advanced age? Or were they insightful and frozen their eggs earlier on in their career and now have an opportunity to use them? So who knows? But it's important to know that it's, you know, as we get to these older ages, it is harder for us to be able to conceive naturally. So why do women commonly seek egg freezing? Well, the majority of them seek it because they don't currently have a partner. It's also commonly sought because you're deferring for professional, social, financial, or other health reasons that having a pregnancy now would not make sense in your life. We know that biologically, as we get older, we're constantly losing eggs. And so we have a diminishing ovarian reserve. And biologically, our eggs have a better quality when they are younger. So when they're before the age of 30. There might be some ethical, religious, or legal reasons why it's better for people to freeze eggs rather than preserving embryos, which are fertilized. And it's even this concept of having a fertility insurance, meaning maybe we don't want to have a kid today, but I do want to have a kid someday. And so this is kind of preserving your ability or taking kind of a proactive approach in terms of how you can kind of safeguard your fertility, as you know that when you get older, it might be harder for you to get pregnant. So who's a candidate for egg freezing? Well, candidates are really proactive women who cannot or do not want to start a family right away, but they do want to preserve their ability to have children. The best candidates are usually women in their 20s or 30s who are delaying pregnancy by at least 2 years. So that's kind of like our general rule of thumb. So what does this whole process look like, and how much time is it going to take out of your busy schedule and life in order to do this? Well, initially you come in for a consultation. We will review with you your medical history and then recommend getting some blood work done with your prenatal labs and also an ultrasound to just take a look to make sure that there's no abnormalities with the uterus. As soon as you get those two things done, we sit down and we kind of talk about, based off of what we found and what your workup is, we create a stimulation protocol, and you would basically find 2 weeks in your schedule where you would be available to come in for monitoring and, which consists of blood work and ultrasounds. And so you would essentially take about 10 to 14 days to do your ovarian stimulation, which will give you injectable medications to help stimulate multifollicular development, so that we can get more than one egg. So let's think about it this way. So in a natural cycle, every month you have a group of eggs that become responsive to hormones, okay? And out of that group of eggs, you get the emergence of one dominant follicle and the rest of your follicles die off. In this ovarian stimulation process, what we do is we take that same cohort of eggs that become responsive to hormones, but we give you injectable medication. So instead of you only getting the emergence of one dominant follicle, that means that one follicle continues to grow. We try to stimulate this whole group to continue to grow. So we're not stealing any eggs from your future. In reality, what we're doing is we're rescuing eggs that otherwise would have died during your cycle if otherwise not selected. So we basically stimulate you with injectable medications for about 10 days on average. And then once you are ready, then you will trigger to kind of do the final maturation process of the eggs, and then you undergo an egg retrieval, which you are comfortably asleep for about 10 to 15 minutes. And we use a transvaginal ultrasound with a needle guide to take out every single follicle that we see and retrieve all the eggs. And then you basically are in recovery, know how many eggs you retrieved during your stimulation. So it's pretty easy, and go from there. So a lot of patients ask, well, how long are my eggs good for? Well, your eggs are vitrified, meaning it's frozen in kind of a glass-like state. So in theory, there have been lots of studies to look about whether eggs, if they're frozen, if they're used immediately versus used years later, if there's any difference in terms of the likelihood that would lead to a live birth. And the reality is no, there's no difference. So technically your eggs are frozen and they're forever young. Okay. And then finally, does it matter where your eggs are frozen? So I would say, just like anything, you would kind of want to go to the person or to the practice that has a lot of experience with freezing eggs. The reason behind it is because freezing eggs is very different than freezing embryos. So your embryos are are relatively have multiple cells in them. The cells are relatively small versus the egg is a single cell. It has a pretty large water content, and you want to have a lab that is very proficient in freezing eggs. So one of the things that would be advantageous is anywhere that you're planning on going, maybe finding out if they commonly do egg freezing cycles, if they're comfortable freezing eggs, thawing eggs, kind of getting that little information from them. That's really important because you want to make sure that you go to a place that's proficient with egg freezing and doing egg freezing cycles. So at Houston Fertility Institute, we're really fortunate in not only are we proficient in doing egg freezings, but we actually even have our own egg bank, which is really important because we stimulate patients all the time to freeze eggs. So our other patients can be able to utilize these younger women's eggs. So that's always a fun thing to be involved with and have that affiliation. It's honestly wonderful. All right. So yes, it does matter where you freeze your eggs. Now, it's really important to know that there are alternatives to freezing your eggs, okay? So let's kind of go through that a little bit. So the alternative is to potentially consider attempting pregnancy sooner, right? Because you technically don't know that you're going to have an issue getting pregnant until you actually try, right? So you know, the sooner you safely feel that comfortable to attempt pregnancy, then you can know if you're going to potentially run into any issues. Hopefully you will not. You can also consider freezing embryos rather than freezing eggs. So remember, the difference between an egg and an embryo is basically an egg that has been fertilized, and it, you know, multiplies from the 1 cell to the 2 cells to the 4 cells, 8 cells, whatnot, and then it becomes an embryo usually about 5 to 6 days after fertilization. So freezing an embryo is great. It's a great option if you have either a partner or you have a sperm source that you feel comfortable in doing that. But obviously, you know, these are fertilized eggs, and so you can't ever unfertilize an egg. And then there's always the option of donor eggs. Donor eggs are a great option for patients that are maybe more mature and have issues trying to utilize their own eggs. So that's always an option available to us. And I like to think that egg freezing is kind of like doing this prophylactically, is giving yourself the ability to be your own egg donor. So meaning you're kind of donating your eggs to the future you who might need them. All right, so chin up, guys, we got this.